Welcome everyone to this special webinar event in collaboration with Vital Nutrients and Fullscript. I'm Amy Regan from Fullscript, and I'm so glad that you've joined us today. A few housekeeping notes. Please place all questions you have in the Q&A section for a chance for them to be answered at the end of the presentation. This webinar is being recorded, and the recording will be sent via email to all attendees and registrants. And there is a copy of the presentation slides in the handout section for you to review during the webinar. We are so lucky today to have John P. Troop, PhD. He is the Chief Science and Education Officer for Vital Nutrients. As a leading industry expert with more than 25 years of successful category and clinical nutrition experience, Dr. Troop provides key insights on the innovation, selection, and use of Vital Nutrients products and advances educational insights to help practitioners and consumers select products to support healthy lifestyles. Prior to joining Vital Nutrients, Dr. Troop served as a member of the senior management team at several Fortune 500, Fortune 50 consumer nutrition health businesses, including Pfizer, Novartis, Nestle, Wyeth, and Unilever. He also led teams at several dietary supplement companies, including Metagenics and Standard Process. Wow, John, we're so glad you're here today.
Thanks, Amy, and thanks everybody for taking the time to join. I'm looking forward to today's discussion. It's one of these discussions that I think is really important to keep in perspective, and I think probably everybody on this call can appreciate the issue of stress and sleep. Some of you are probably wondering what the component of sex are, and we'll get a little bit closer to that, and I'll describe that as we get going here. The purpose of today's discussion, my intent over the next 45 or so minutes that we have together is to introduce some concepts that I think have important connections that we don't always think about, particularly when we're thinking about underlying systems to control. But I don't think there's any other set of issues like stress, sleep, and its effect on, frankly, reproductive function, which is the sex component of the talk today, is basically how they all work together. And my whole point that I'll share with you now, and then we'll summarize at the end, is to help everybody fully appreciate the impact that stress itself has, and that unlike a lot of other underlying systems, can't be used as a single targeted approach into managing the overall influences, because stress alone reaches so many different issues, health issues, and conditions that we need to talk about. So my intent today is to rapidly go through some of the more important components that affect stress and how and why we can manage them. And so for those of you who may have had a chance and participate in some of our previous webinars, our whole approach is really trying to understand and fully appreciate the role that the underlying systems have as opposed to addressing a symptom. And so the issue, again, to emphasize, is that it's not just a single system. You want to be careful of having to play a whack-a-mole. If you address one system, you may miss another one. But it's more about an integrated cross-system signaling and response that's most important, I think, in stress and all of the components and health issues that stress can have a direct and even indirect effect on. And so we'll talk about what those are, and that'll include what role does the gut play, what role does the neuroendocrine communication and metabolic control play, and then ultimately, as a highlight, and probably the one area that has its biggest effect by stress conditions is really reproductive health and fertility. So let's start off with a little bit of an overview on stress. About 5 years ago now, a group called Living Matrix did an analysis on somewhere in the neighborhood of about 40,000 different clinics and over 70,000 patients. And they were trying to map the influence and the impact that, say, stress has on associated disease states and conditions. And so it's clear that those people who were reporting high stress levels also had high levels of depression, other associated issues like digestive health issues, and then a number of other what could be considered minor issues, but still pretty important in the overall issue. And so my whole point here is underlying stress is more than just being able to relax, but it has major influences on health systems. And so when we talk about stress, there's a whole sequence of events that I think it's worth putting in perspective. And it really starts off with this kind of a bell-shaped curve. People get used to the idea and are comfortable in a stress-free. A little bit of stress improves your attention to the point where you've got a lot of attention. But if you get over that peak point of performance because there's too much stress, then basically what will happen is that people will lose emotional control. They'll start to freak out and they'll crash and burn. And that really was my whole point here, is that a normal sequence of stress that you can see on this side is okay, as long as you stay away from reaching the point that stress is out of control and you're doing something that may not be the best thing to do for anybody. And so this bell-shaped curve helps us identify we want to be at the peak of this area, or even to the left side, or close to the peak, if at all possible. And the good news is that if we understand the underlying systems of influence and the underlying contributions that key nutrients can have on helping us manage stress, then we'll be more effective at managing the overall process and improving all those conditions that are important in our overall health. And so what that really means is the HPA axis, the hypothalamus pituitary adrenal axis, is core to bringing together a network of neural communications, but also endocrine system. And because of the endocrine system stimulation, it also will affect our ability to control the metabolic system. And so that's core to the system, but it's not the only system that we have to worry about. And as we'll see, the digestive GI system plays an important role, and then that affects our hormone system to a greater extent for a number of disease conditions, including reproductive health. So stress has really, I would describe it as 4 important conditions to consider. Starting at the lower right-hand side, it's inflammatory signaling and immune response. That, by virtue of its interface with the metabolic system, will influence our glycemic regulation or lead to dysregulation if we're not able to control it. That'll increase the amount of stress that we would describe or experience, and then ultimately it will disrupt circadian rhythms. It'll lead to disruptive sleep patterns, and then all of that accumulation of stress can have effect on a number of different chronic disease states. And the one that we'll talk about the most today will be the reproductive health and fertility. And so stress has direct links into compromised health conditions, including these listed here. So long-term stress is really our inability to cycle stress recovery, and frankly, our inability to cycle cortisol levels. And so that HPA axis is core to that, and if left really unmanaged, it leads to cardiovascular diseases, including high blood pressure. It leads to metabolic-based diseases like diabetes. It leads to digestive disorders. And ultimately, all those are tied to the underlying systems that affect sleep, more metabolic conditions that can lead to obesity, immune system disorders, and then ultimately, if there's too much stress can naturally progress into mood disorders, into depression, and really serious anxiousness. In terms of chronic health problems, particularly as an association of stress to sleep deprivation, we see here that sleep, particularly as we'll talk about resilient sleep and deep sleep in particular, is really important in being able to manage that whole process in these underlying systems. And so if you look at their recommendation, particularly for healthy adults, of trying to get at least 7 hours of sleep, there's a higher association with the development of these disease states with people who receive less than 7 hours of sleep. And so you'll see people that are sleep deprived and full of stress, you'll see higher incidences of the development of these disease states with arthritis, depression, asthma, metabolic disease states like diabetes, cardiovascular disease in particular, and even the development of some cancers. And so if you look at and step back in an overall picture, it's really a complex system here. And to the right is really a schematic of what stress does. It influences the HPA axis. It also will affect the synaptic nervous system and the network communications. And it'll influence, obviously, hormone balances or imbalances. And all that is tied also to the gut, and vice versa. The gut is directly tied as what we would describe as the connectome from the nervous system into the HPA axis, into the brain centers that play an important role. And so you can see when people talk in particular about adrenal fatigue, I prefer the term adrenal dysfunction, that all that is really tied into the broader HPA axis that's tied to the influence and the imbalances that are caused with the endocrine system and the metabolic response to those hormone changes. So with that as an overview, I hope I have at least laid the groundwork is that stress is a major contributing issue and factor to a number of our health states. Beyond that, let's now talk about some of the specific underlying systems that can have an effect on both good and or bad on our stress response to help avoid the progression of stress into other disorders that we would have to deal with. So again, just to summarize, the HPA dysregulation, particularly tied to this concept of adrenal fatigue, can basically be seen with four key issues. The gut-brain axis plays an important link because of the neuroendocrine balance and its impact on sleep and reproductive health. What we now know about the microbiome, we'll talk a little bit more about this, is that while probiotics can be important and their colonization in the gut is important, what's really emerging as probably the most important factor is that what we put into our gut influence the metabolites that are produced in the gut, and it's those metabolites or intermediate metabolites that can be absorbed into the gut that influence metabolic systems and metabolic control systems, and can directly influence the network of the nervous system communications. And as a result of that, it can have major consequences on that core system of the HPA axis that we talked about. And as a result of that, all of the stress response can be basically moved out of whack. So the underlying systems deserve and require resiliency and recovery phase. And this is where the whole concept of sleep and resilient sleep plays a big role. We'll talk a little bit more about that, but probably the most important component of sleep, I believe, is deep sleep, or basically recovery and resilient sleep. And so that is a major important and part of the stress and our ability to manage a stress response is to allow the body to go through a full recovery phase, because the sleep cycle, as we'll see and talk about, really is as important in not just providing rest and preparing cognitive performance, but it also plays an important role in our ability to reduce inflammation and to recover. As a result of that, the third system that's really important in understanding how to manage stress is basically what it does to our immune response and inflammation. And so the resolution of inflammation becomes really an important consideration too, and these second and third issues play an important component. And then finally, the reduction of the stress in our life. Those are environmental exposures that we have, either an environment that we're in that's causing too much stress, frankly, even the people that we may be working with, or the work that we're doing in a particular time, or the normal stresses that ebb and flow throughout our lives. And so these are the four major issues that we want to make sure can be addressed and understood in managing stress and limiting its progression to compromises in health states. So I mentioned the metabolites in the gut, and this is an important consideration because these metabolites have really a major effect on the network communications. The central nervous system, and particularly there are 15% of the central nervous system that leaves the gut and then goes to the brain and influences the HPA axis. And the reason why they play such a regulatory role in the role of stress is that basically the central nervous system has its own immune system. And that immune system are basically called microglial cells. And those microglial cells can be inflamed, and they're inflamed under stressful conditions. And so our ability of these to control these metabolites in a way that provides a healthy response to the microglia, so inflammation of the central nervous system can be reduced, plays an important role. If that can't be controlled early on, what will happen is there'll be a release of metabolites, there'll be a release of hormones and neuroendocrine responses to the HPA system that will lead to an increase in cortisol that then will send communications back to the gut. And then it becomes really a negative feedback loop, if you will, or a vicious circle that will basically throw the hormones and the metabolites out of balance. to the point where that stress will lead to the progression of digestive discomfort and a whole host of other issues. But the most important point is that interface of the digestive system to the HPA axis is very real, and it plays a pivotal role in our ability to manage that stress response in a normal way to keep metabolism healthy, recoverable, and resilient. And so here's another schematic that more specifically shows how stress can, as a result of the HPA axis of communications and networking communications, will result in an increase in cortisol. And so you can see in the schematic on the right, cortisol has negative impact on the metabolic system, and it will increase the insulin resistance, and it'll also have an effect on food cravings and in the development of obesity, as an example, and can have negative effects not only on weight gain and obesity, but cardiovascular diseases as well. And if that sequence of stress response results into sleep loss and sleep disorders, then all that just becomes really accentuated, and it becomes even a harder issue to deal with. So sleep is actually our friend and can help really manage and balance the stress in a much healthier way for productivity in our lifestyles. And so the brain-gut axis, again, can't be underestimated. One of the trends and signs that we're seeing in microbiome research today is that there are certain strains of probiotics that are producers, and maybe even higher producers of certain metabolites. So getting the right probiotics and making sure that the metabolites that are produced in the gut are favorable is really important. So we know that there are classes of both probiotics and actually now emerging postbiotics that are big producers of things like tryptophan, of butyrate, of GABA. And getting that right balance with the right strains and actually the genus and species of probiotics is an important component in setting the metabolites in our gut so that the network communications and that connectome to the brain and to the HPA axis can be as favorable as possible, and that our metabolic processes and neuroendocrine controls can be maximized. And so that's why, in short, with the emerging science that's happening, that link of gut-brain axis becomes really important and plays a predominant role in our ability to manage the stress response. And so stress then, if left unchecked and left unbalanced, is really a complex issue. It's not just about managing cortisol, but it's about balancing, rebalancing, and resetting the network of communications of these systems. So it is balancing the HPA axis, it's balancing the gut microbiome in a way that can be complementary. And then the most immediate underlying systems that are influenced, which happens to be sleep, then also need to be balanced. So it's not just balancing cortisol, it's trying to find a way to manage each of these systems in a very targeted and specific way. Let's talk a little bit about sleep then. And so who's catching the most amount of sleep these days? Maybe not too surprisingly, it's not the baby boomers. It's basically the Gen Zs. And so they perfected the ability to capture good quality sleep. And what's really important in sleep is really not only REM sleep, but probably underappreciated within the whole sleep cycle until recently is this concept of deep sleep or resilient sleep. And so just being able to fall asleep and staying asleep is nice, and that can probably be easily done with some simple nutrient solutions. But being able to capture the cycle of deep sleep, where there are probably 3 or 4, maybe even more, depending on who you are and how long you sleep, of this phase of resilient sleep, which only lasts 10 to 20 minutes, is really important because that's a healing sleep. That helps facilitate recovery. It helps facilitate the cortisol balance and the control in the overall stress response. And it'll result in an improvement in our overall cognitive performance, our ability to stay focused and be attentive. And so the length of sleep will influence deep sleep, and it's the deep sleep component that's really most important in this whole concept of stress management. We probably all are aware of this, that seasons do impact your sleep, and it's not too surprising as daylight savings time provides more daylight hours, more of us stay up longer because there are more things to do. We're outside, hopefully we're doing more activity and staying active. And will get less sleep, which makes it even more important during some of these phases to make sure that we're able to get a handle on the stress response and at the same time improve sleep and to maintain our overall health status. Are we waking up earlier? And who's waking up earlier? Well, not too surprisingly, right? It's the baby boomers that are waking up a little bit earlier, and the Gen Zs that are sleeping in longer. And so it's an important, as you're working with patients, to understand what their typical, not only their stress response status is, but what are their sleep patterns, and are they getting the requisite minimum number of hours of sleep, and how are they sleeping through the night, and then also when do they get up, and is there a way to improve the sleep cycle that's supportive of the stress response and not just kind of an incidental response to high stress levels. So sleep deprivation is probably the first sign that is affected by stress, but sadly, and maybe even more importantly, it's that sleep deprivation and disruption that we can't get a handle on it will lead to an acceleration in the disruption of sleep and in the increase in stress that then will be resulting into a progression and acceleration of chronic disease states. And so understanding that stress is happening at an all-time high level and stays high for too long of a period of time rather than cycling means that it's time to start taking a look at sleep as really, let's just call it a co-therapy or a platform issue that's really critical to understand. So sleep deprivation, particularly resulting because of increased stress level, will result in irritability, cognitive impairment, change in cognitive performance, and then also in our ability and overall performance to decrease and lead to a progression of chronic disease states. So sleep disruption linked to stress has a major influence on the development of chronic disease states. There are basically 5 stages of sleep that are really important. That first stage is that drowsiness. Think about it when either maybe you're watching TV or an NBA or an NFL game during the season, you may catch yourself feeling drowsy and kind of nodding off a little bit. Stage 2 is that light sleep. But hopefully by this time, if you're experiencing stage 2, now you're actually ready for bed, you're laying in bed and you're relaxing. And then you will find yourself entering stage 3, which is moderate sleep. And that usually lasts about 20 to 40 minutes. And after that, stage 4 becomes one of the most important phases of sleep, and that's the deep sleep because of its resilient nature and ability to heal and help heal and facilitate the healing processes of our bodies, not just our brain, but actually the entire body. And it's after this deep sleep stage that lasts about 10 to even 20 minutes that REM sleep will occur, and that's usually about 20 to 40 minutes, and then the cycle starts over again. And so over a 7 to 8 hour period of time, that cycle will repeat itself. What will happen is that many of you may experience, hey, it's not a problem for me to fall asleep. My head hits the pillow and boom, I'm gone, I'm sleeping. But what many of us experience is that 3 o'clock wake up call. And that 3 o'clock wake up call is primarily driven because of disruption in the immune response system, driven by an elevated cortisol that's not rebalancing itself. And so that's the underlying problem that's happening. It's not that your mind is already racing. Your mind doesn't start to race until you're up and you realize, hey, I'm up. And then your mind starts to wander and start thinking about things that feel like they're out of control. And that doesn't do anything to help address and manage and reduce our stress levels. And so getting back to sleep is really important. But again, it's all kind of a hand in glove and a sequence of events that needs to be fully appreciated and managed together, not as a sequence of events. So sleep deprivation, as we talked about, has a number of increased risks that you can see here, particularly of concern are those related to the development of metabolic disease states and conditions, particularly obesity, diabetes, cardiovascular disease. And those are all associated also to higher stress levels that can lead to higher levels of anxiety. And so this slide shows, again, not only those 4 or 5 major stages of sleep, but the recommended number of hours of sleep that are important. Some people have asked and thought that, gee, the older you get, the less sleep that you need. And actually, that's really not the case. What happens is that underlying inflation increases with age, and particularly will increase with age if activity levels are low. That underlying inflammation can lead to and contribute to increased stress levels. And as a result of that, then there's actually a minimal amount of sleep, which is really that 7 to 8 hours of sleep that's really becomes important to help facilitate the resiliency and the healing process in our bodies. So sleep is important, and managing sleep then becomes even more important to manage that entire interconnected system that we're talking about. Circadian rhythms are always an important consideration because of the sleep cycles. But one of the key points that I wanted to leave with you today is that sleep is a major regulatory process or a major regulatory component of our ability to stay resilient and to basically recover and to be able to minimize the progression of chronic disease states. And so you can't think of sleep as only making you feel refreshed and improving your focus and attention. It does all that. But what's really important is that deep sleep component, which means resiliency and healing, so that the underlying inflammatory processes in the immune system can basically heal and be refreshed and recover in its own right. And so sleep, I hope that I'm sharing with you an insight that is really an active component of our ability to stay healthy and to avoid the progression that the negative effects that stress can have on our health status. If you look at what we can describe as the sleep cycle, and that's the difference, or sleep index, that's the difference between the recommended numbers of amount of sleep and the difference with how much sleep you actually get. You can see that sleep index declines with age. And interestingly enough, if you look at the entire aging process, that aging process begins right around that 35 to 40 year age range. And what that means is that involuntary things that start happening to us as we reach that threshold, that age threshold, is also seen in decreasing sleep quality. It's also seen in our inability or the difficulty that we have in managing stress that we may have experienced and handled better before 35 becomes a little bit more difficult. And by the way, there's a high correlation between these changes and the age of which the first diagnosis of a chronic disease takes place, which is also between 40 and 45 years of age. And so there are a lot of things happening in that age window, 35 to 45 and 50, that we need to be aware of that have its genesis in the underlying system of the HPA axis, stress, poor sleep, and changes in sleep, and in the progression of these disease states. And so that's an important age range as you're working with your patients, is to understand where they are in that age continuum, also in their biological age, but where they are in the continuum of the stress continuum and even the continuum of sleep quality. So sleep cycles closely parallel cortisol cycles, not too surprisingly. So as cortisol increases, melatonin decreases. So the body naturally produces melatonin, as we all know. And so as melatonin decreases, cortisol will increase. And so the use of melatonin can actually help balance and rebalance the cortisol issue in its own while. And melatonin, with some of the emerging studies that have been done in the last 5 years, clearly show that melatonin can help us resolve the inflammatory states, and that it can improve the quality of sleep, the ability to reach deep sleep, and as a result, manage that whole stress cycle. So as cortisol falls out of balance, sleep cycles are disrupted, stress increases. And so when all of those things happen, it leads to a progression of health complications to the endocrine metabolic effects, and then that can all cascade and continue and progress into a number of different chronic health diseases. And the one that I wanted to talk a little bit more about are changes and increased risk of infertility and changes in reproductive health. So melatonin, just one last word about melatonin, is really an important component in our bodies. The ability to maintain levels of production and availability of melatonin decreases over time and with age, and it's an important inflammatory or anti-inflammatory nutrient. And so rather than thinking about melatonin is basically a circadian rhythm and a sleep ingredient, that's just half the story. The emerging data on its impact on the immune system, and inflammatory response, and stress cycle, and resiliency is really very compelling and significant clinically. That's worth taking another look in consideration using melatonin as part of your therapy for your patients. So recently, we were part of a study where we looked at the HPA axis as a central role in the systems for balanced health. And what we were able to do is look at where changes in our lifespan and in our health span changes in particular. And we now know that for those individuals that early on in that 35 to 45 age range, where there's an onset of chronic diseases or complications that may be stress-driven, or changes in adrenal fatigue and dysregulation take place, those people who experience that usually have higher risk for poor consequences later in life. So a lot of these changes early in life have a predictive effect on what our health state and health status can be later in life. And that's particularly true if you also look at, in the case of reproductive health, women who have more difficult phases in PMS and greater irregularity of menstrual cycles will also lead to it, and more than likely have more difficult consequences in perimenopause, and postmenopause will put them at greater risk of a number of different states, including cardiovascular disease, stress levels, and even osteoporosis. So there's a whole sequence of studies that we've identified that we're happy to share with you if you're interested in more of this information, that show a link starting really at that 35 age range and stay with us throughout life, that we need to be aware of, because that, and knowing that, will have a consequence on the therapeutic order and in the functional medicine matrix in our assessment of patients that we should be aware of. And so let's talk a little bit about the fertility continuum. The fertility continuum includes three major phases: the genetic predisposition, healthy viability in sperm, and the health trajectory of the mother and baby. And then in the case of stress and basically sleep disposition, 2 and 3 are major components that are affected by those two issues. There are really about 7 or 8 issues that we can control by lifestyle changes in nutrition. And what I really want to spend most of our time is really talking about lifestyle stressors, environmental exposures, and nutritional balance that will have an effect on our reproductive health overall. And so if we look at male stress, we now know from clinical studies that male stress itself can have really a negative effect on the fertility of males, even to the point now there's really good epidemiological studies that have demonstrated increasing sperm count in males during their lifespan and across the entire population in all regions around the world. So part of what we've been talking about is the connectivity of a number of systems, and reproductive health is probably the one that's most obvious and has the earliest effect that we should be aware of. And being able to understand this combination and interrelated networking of effects can be helpful in managing patients, whether they come to you with an infertility problem, or they come to you with a stress problem or sleep problem. There's connectivity, and the age, status, and segment of the patient you're dealing with should be closely looked at, because depending on that combination of issues that I just described will depend where you start in being able to put together a therapeutic plan for your patients. So reproductive success has probably in the neighborhood of a 40 to 60% impact by the environment and stress factors. And it's important that that's really pretty high, but it also can contribute to the impact that nutrition can have, because taking a nutritional and a nutrition therapy approach into managing these issues can have a significant and fast effect on these patients. And so the HPA axis, again, as you might expect and not be too surprised about, has a direct effect on the hypothalamus gonadal axis, the HGA axis. And these two responses are closely aligned and co-responsive. And so that's why the stress factor and adrenal health, adrenal function becomes really important to understand the dynamic of the HPA axis, because it's not just cortisol balance, it's just not adrenal function. It's the consequences of those responses that we need to be able to manage and understand how, when, and where, and with what we can put into place that will really make a big difference. And so here's how stress in the reproductive system is linked to sleep deprivation. You can see this schematic here that basically stress leads to sleep deprivation, leads to a number of changes in hormone and the endocrine responses, particularly the reproductive hormones. And then those lead to changes in compromised fertility and basically can lead to or make worse infertility. The good news in all this is that understanding this schematic and these clinical algorithms and guidelines and guides can help us do a much better job and probably have a greater significant effect and a faster effect in managing the patients in being able to stabilize the issue. There's probably a large consequence, a large attention to what's considered idiopathic infertility, where nobody knows what the consequences are. But I think traditional medicine in particular, should take a closer look at this consequence of the systems we're talking about, as it has a major effect, as can be seen by the connection of these issues that we've illustrated in these diagrams. And so what makes it even more interesting in fertility is not just about infertility per se, but it's the continuum that basically our genetic predisposition and that infertility can play, and the health of the sperm and the egg and the embryo has because of stress, sleep, in the HPA axis in the endocrine metabolic system. And so understanding the consequences can have a generational effect. And so depending on the health profile and the viability of the sperm and the egg in particular, will have consequences on not only the health of your baby, but also the health of your baby's baby in time over a generation. So this is a multi-generation impact. We can describe it as an epigenetic impact, but it's very real. And it's really important to understand those potential consequences that can exist in individuals. So fetal development is important, but the health and viability of the sperm and the egg, even before an embryo occurs and is viable, is an important consideration in understanding stress. And when we talk about stress, as you all know, there's a number of stress issues or stress factors that we should be aware of. So it's not only, if you will, the psychological, mental stress response, but it's also the stress caused on and brought on because of environmental exposures to issues that also can be considered a stress factor that influences the HPA axis, that influences reproductive health. And so these are all important to be fully appreciated of. It's been thought that basically that total sperm count has declined by 60% in the last generation and up to 2 generations is a result of these environmental stressors. And so there's really compelling and really good, strong epidemiological data that emphasizes this now. And the good news is that we can identify it, we can understand, describe and understand a contributing factor to the stress and changes in reproductive health. And as a result, there's an opportunity for us to do something about it with a targeted, planned effect. And so one of the things that I wanted to point out is that if you look at the health span of a developing embryo and baby, probably the most important phase is this, particularly generationally, not only in the development of sperm and the viability of both the egg and embryo itself, because of the DNA fragmentation that can occur because of exposure to environmental stressors, but even in the development of the baby, this basically 4 to 8 week period of time shown here can be influenced to a great extent by changes in stress levels, changes in hormone levels, and the environmental exposures that the embryo itself can be exposed to. So not only is there a generational effect, but there's also the term course and the gestational effect that stress can have on the health of the embryo and baby. So there's been a number of recent clinical studies that have looked at phthalate exposure and these environmental stressors. We now know a lot about that. We can actually identify the effect that it has on androgen deficiency or reproductive hormone effects and the adverse effects that different environmental compounds and toxins can have in our diet. And so understanding what we're being exposed to, removing those from our environment or moving away from those ourselves become a major component. But it's not just what you might think is an isolated environmental exposure, but it's also in the products that we buy and the plastics and the types of plastics, and particularly that we might be exposing ourselves as we purchase personal care product, as an example. And so it's important to take a look at that, particularly with a patient who may have chronic stress and fatigue. But here's the take-home message that shows a better link between the HPG and the HPA axis. We understand these reproductive hormones are influenced by the release of these hormones released by the adrenal gland and cortisol in particular, and the effect that it has on reproductive health. And so there's a very direct effect on these reproductive hormones that can be controlled by improving and managing the stress response, improving our sleep capacity and response, and being able to improve fertility and decrease the risk of chronic disease states. We know that antioxidants can play an important role as a result. There have been a number of clinical studies that we sponsored and that a number of other major universities are now taking a look at in reproductive health, particularly of women and their partners, males, and the effect that oxidation has on both the sperm viability and egg viability. And so the data, the clinical data on the use of nutritional support to help manage this is really good and really compelling these days. Let me go on and just mention one last system, and that's the endocannabinoid system. And so what's important about the endocannabinoid system is that it plays a major role in metabolic control and a major role in the combination and association of the endocrine system with the metabolic response. And the best way to be able to manage the endocrine system is, number one, omega-3 fatty acids. Omega-3 fatty acids are actually the precursors to the development of cannabinoids. That includes basically terpenes, phytoterpenes, polyphenols in general, and they're the ones that are the key activators that you'll see in phytonutrients and play a key role. And so making sure that your diet is full of the right phytonutrients and polyphenols and terpenes in particular are really important to be able to get this balance. So you don't need hemp oil necessarily. You don't need to be using medical marijuana specifically to manage stress. In fact, there's some data recently that would suggest that they don't have a great long-term effect at managing and reducing stress, but these terpenes do, as do omega-3s and a number of other active compounds and active nutrients. So we know a lot about the endocannabinoid system. It's completely underappreciated and probably poorly understood, but it plays a major role in being able to combine that into our thinking and putting together a therapeutic plan can have a major benefit in putting together the whole solution for this whole connectivity of these systems. And so here is a quick illustration of the role that terpenes and the endocannabinoid system has on basically ranging on the development of stress and anxiety to pain, and then how to manage both pain relief, relaxation effect, and also to decrease the inflammatory response. And so this is one of the last slides that just shows an overview, kind of, if you will, a 20 to the 30,000 foot view of how the HPA axis, the adrenal system, our central nervous system, and the connectome is affected and connected to our digestive health product. It affects the hormone response, it affects the metabolic control imbalance, and it needs to be reset in a way that reduces the first symptom, which is stress. There's an underlying system for that, and it's related to the sleep systems, the GI system, the endocannabinoid system, and basically the metabolic and hormone system. And so let me finish and putting together a couple of clinical insights for you and go right through some clinical guidelines. And so our presentation, which will be available at the end of the presentation, can be seen here. We can look at and provide some clinical decision trees, or if you will, algorithms in how best to manage the issues that you're looking at with your patients. Is the starting point elevated stress levels, and it may be cortisol, But our suggestion is that as you look at these guidelines and algorithms, look at the starting point of where your patients are. Is it just high cortisol level? Is it poor sleep? And you can be pretty sure that no matter what the starting point is of your patients, that they're all connected with each other. So they may come to you with stress. That probably means they have a sleep disruption, and they may be having some metabolic conditions. If they're young enough, that 30 to 35 age range, they may be experiencing some reproductive health issues, whether that's accentuating the problem of PCOS or infertility. It's all tied together. And so we would encourage you to look at these algorithms, find out where your patient is starting from on presentation, and then being able to put together a full therapeutic regimen that really involves a therapeutic order, but doesn't dismiss anyone and doesn't wait too long to introduce basically an approach to help manage the multiple systems at one time. That'll get you ahead of the curve rather than going through one, the next, then the next. But knowing what's available through epidemiological data and a number of the clinical studies that we presented today, I think can be helpful to you in putting together a pretty effective program in managing the health status and the outcome of your patients. So with that, let me thank you for your time. I hope I've left with you a couple of important components. Stress, sleep, reproductive health are all intimately tied together. When you see a patient present with any one of those, look at a total systemic underlying system approach to helping put together a therapeutic plan for your patients, and start working them right away to help them understand what the issue is, and use some of the ingredients and the nutrients that we talked about during the course of this discussion. So with that, again, let me thank you for your time and attention, and I'm happy to answer any questions that you may have.
Excellent. Thank you so much, John. What an informative presentation. And we've got a number of questions coming in. We have a little bit of time with John, so anybody who has anything to ask, please do so. Let's see. So Paul asks, he's interested if you can share any information about the development of what cancers specifically are correlated with high stress. Do we have any information on that?
You know, there's a little bit of interest to that, but most of what we're seeing are primarily related to cancers of the digestive tract, and that's not too surprising because the inflammation can initially be isolated and start in the gut. So that set of data that's available and emerging is probably the best and most well studied to date.
Excellent. Another question we have is, they're concerned about supplementing melatonin will disable the ability to produce melatonin naturally. What are your thoughts on melatonin?
Yeah, so melatonin, I think, as I mentioned during the course of the presentation, I think is an underappreciated nutrient. While it's endogenously produced, I'm not familiar with any studies that would suggest that it would reduce the ability to endogenously produce it. We know that it plays an important role not only in setting and helping to set the sleep cycle, but what's really important that's new in the last 5 years is basically the role as an ability, an ingredient that plays a significant role in influencing and managing inflammatory response, and that's its own targeted effect. And so there's really no negative feedback into the ability to produce it or its ability to activate receptors. And if there are, I'll keep looking, but I haven't seen those or aware of those. So I don't think it's a concern.
Great. Elizabeth asks, what is the time frame that defines sleep deprivation? What does that look like?
Well, I guess it depends on who you talk to. Right? If anybody gets a poor night of sleep one night, they think that they're sleep deprived, right? And they're probably right about that, right? I mean, if you ever, try to operate in 4 hours of sleep, it's not a lot of fun. If you have 2 nights of that, you feel pretty irritable in anybody you come across, right? So I'm not fully aware of. I mean, I'm sure there are sleep associations and societies that have defined what sleep deprivation is. But taking this is a scientific based guess at it, that I would bet that anything with consistent 5 days of poor sleep and less than say 6 hours of sleep in my book, would qualify as disruptive sleep, and its ability to recover from that and to, if you will, fix it, probably just makes it another part of that definition as well.
Excellent. Tracy asks, have you noticed any specific correlation with stress and decreased lipid absorption?
We've not studied that, but it stands to reason that that may be the case, especially with all the changes that may be happening in the gut, or nutrient bioavailability may be compromised. So I'm not familiar with that, but I wouldn't find that too surprising.
Excellent. Lisa asks if you have a recommendation for someone who wakes up every night at 3 to 4 a.m. and is unable to get back to sleep.
Yeah, so 3 o'clock, wake ups is probably the classic sign of sleep deprivation and contributing stress. And the biggest reason why that happens is, by the way, at 3 o'clock, there's also an immune cycle in the body. And so the 3 o'clock time point is where the immune system kind of kicks in again as part of its healing process that's tied to deep sleep and resiliency and healing because of sleep. And that's all driven by elevated cortisol levels, which disrupts that ability to recover itself and to go through its normal cycle. And so when that happens, the first issue is basically to look at cortisol. Are they elevated, and the individual is not able to cycle through cortisol levels? It's always elevated and never cycles back to rest. So that's the first question that should be asked or even tested with some diagnostics. But then the second opportunity, then, that because of the sleep deprivation that's experienced, there are a number of formulations that include melatonin, but also other nutrients that play an important role in rebalancing cortisol and setting into motion the underlying systems that lead to relaxation and calming effects. So like ingredients like theanine play an important role. GABA, 5-HTP, tryptophan, there are a whole host of ingredients, ashwagandha, that play an important role in reducing cortisol and that are precursors to the development of serotonin, that happy hormone that can help relaxation occur. And melatonin, let's not forget about melatonin. Clearly, the evidence is strong on the clinical benefits of melatonin to fall asleep and stay asleep. That data is really good. But that stay asleep portion, to sleep through the 3 a.m. cycle, can also be influenced with melatonin plus a couple of these other ingredients that I described about. And there are good clinical data and good clinical studies to show that that's pretty effective.
Excellent. Yeah, that makes sense. We have some more thoughts on melatonin here. So Francisco says that they understand smaller doses of melatonin are useful to reset the circadian cycle, and higher doses are useful for their antioxidant effect. What dose do you recommend? And is the sustained release dose better?
Yeah, so typically for sleep, that ideal dose has always been described between 3 and 6 and maybe even 3 and 9 milligrams. For its role as an antioxidant or its role in the inflammatory healing and recovery process, typically we've seen the neighborhood of 6 to 10 milligrams. There have been some studies that show as high of 20 milligrams on a consistent daily basis for 12 weeks or more. But I think that optimal dose range to start off with really is at 6 to 10 milligrams. But, as the practitioner dealing with each patient who's an individual and have different responses, it's important for you to take a close look at that and make a full assessment before you diagnose any one of those doses.
Makes sense. Switching gears a little bit, Suzanne asks, thinking about sunlight and the digestive and endocrine health, do you have any thoughts on the value of sunlight on our gut and endocrine health? And she also says, thank you so much for the presentation.
Yeah, thank you for joining. Yeah, sure. So sunlight does one important thing for us, right? Produces vitamin D, right? So vitamin D is really, a hormone, or prohormone, that plays an important effect in every one of the systems that you just asked about. And also melatonin is also influenced by sunlight. All right. So yeah, sunlight itself can be a great therapeutic, both helping in resetting your sleep cycle, but also in being able to support the availability and the production of vitamin D, which also plays an important role in all these systems that we've been talking about.
Excellent. I'm just trying to, we just have a couple minutes left here. So let's see. Do you have any thoughts about phytocannabinoids for sleep regulation?
Yeah, so if you look at what the phytonutrients or phytochemical profile of phytocannabinoids are, you'll see compounds in there like cannabidiols that are also could be high in a compound called TH2. But the most important and underappreciated and not discussed often enough are the phytoterpenes or the terpenes. Mm-hmm. And so the most important terpenes that you'll find in a lot of these oils are basically something called a beta-caryophyllene. And so beta-caryophyllene is really important in activating the CB2, the cannabinoid 2 receptors. All the kind of the mood altering abilities are stimulated by CB1 receptors, and that's a TH2 activated receptor. And so overall, I think that for what we're talking about today, the most important receptors are the CB2 receptors, and the most important phytoactive that activates those receptors are terpenes, beta-caryophyllene. So if you can find high sources of beta-caryophyllene, that's a good starting place to look at as a cotherapy with melatonin or a number of the other nutrients and ingredients that we've talked about and mentioned during this discussion.
Excellent. Kathy asks, what do you think about insensitive receptors and specifically receptors for endocrines? Excuse my pronunciation.
Receptors in the skin, I think are important, right? They play an important role on the expression of melanocytes and a whole host of other issues that can cascade into the rest of our body. So, and it's part of the rationale of why skin biotics play an important role as well, right? So I think they play an important role. I think there's a ton more research that still needs to be done. Obviously, as is true with everything we talk about these days. Yes. But I think there's an opportunity there for us to better understand that and then to try to pursue solutions around it.
Excellent. Do you have any recommendations for supplements that include terpenes while discussing terpenes?
Yeah, so there are a number of combinations. There are products even in the vital nutrient portfolio that are called Sleep and Restore, Melatonin. There's a product of cortisol balance that address multiple underlying systems that we're talking about. And really a number of companies have these combination products that are pretty good that try to address multiple systems. Most of them don't have phytoterpenes. The vital products do, but again, if you can find a good source for beta-caryophyllene, it's really important. Most of you might recognize like black pepper. That's actually has been historically a good source for terpene, but it's too low. So you got to look at things like copaiba oil, which is a really an excellent source of phytoterpenes, and that can be a pretty helpful nutrient as well.
Excellent. Well, we're just getting to time, so I want to say thank you so much to everybody for joining us, and especially thank you to John for the great presentation. Everyone take a look out in their email within the next couple days for a link to view the recording. And anyone who has any additional questions can send them over to me. That's Amy Regan, amy.regan @fullscript.com. And I hope everyone enjoyed the presentation as much as I did. And thank you again, John. It's really, really great to be able to dive into these topics and to get your thoughts on these questions.
Thanks, Amy. Thanks to Fullscripts for your help and support. And thanks, everybody, for your time.
Excellent. Everyone have a great day. Thank you so much.